Salam Fisioterapi Indonesia. Kami akan menampilkan video pembelajaran yang berjudul Post Operasi Anterior Cruciatum Ligamen 6 minggu yang lalu. Selamat menyaksikan.
To keep the joint stable, a set of 4 ligaments keeps the knee in a hinge-like position while you move. 2 ligaments on either side of your knee joint, the medial and lateral collateral ligaments, connect to either side of your femur and tibia and limit shifting movement left or right. The other 2 ligaments, the anterior and posterior cruciate ligaments, connect from the base of your femur to the top of your tibia. They cross each other and prevent the knee from excessive forward and backward movement, as well as twisting movement in either direction. If a movement is forceful enough, any of these ligaments may snap, including the ACL. Once torn, the ACL cannot regenerate or repair itself. The ACL reconstruction operation is now typically a 1-hour outpatient procedure, performed successfully more than one way. We'll examine one of the more common methods used in ACL reconstruction. The entire surgery is completed through just a few tiny incisions. One is made for the insertion of a tiny camera and to deliver fluid to establish a clear view of your joint. 1 or 2 additional incisions are made on either side of your kneecap to give the surgeon access to your joint. 1 very small incision is made to anchor the new grafted ACL in place. To start the procedure, the surgeon will insert a probe to inspect the damaged joint. A small motorized shaver will then be used to remove the damaged ACL and prepare the area for the new one. In every case, a surgeon will also inspect the entire joint to determine whether there is additional damage warranting other repairs. Then, the surgeon will use a device called a retro-flip cutter to create a tunnel through the femur and into the knee joint. The surgeon will also create a tunnel through the tibia and into the knee joint from below. These 2 tunnels become the source of the anchor points for the ACL graft. In most cases, the surgeon will harvest a portion of your own hamstring tendon to use as the graft. Using your own tissue reduces the likelihood of your ACL rupturing again, and is a reason some surgeons decide not to use a tendon harvested from a cadaver. A surgeon will harvest more hamstring than needed to avoid the challenge of not harvesting enough. To the patient's benefit, hamstring tendons consistently regenerate over time as well. Your surgeon will prepare the harvested hamstring and pull it through the upper hole and into the lower hole just taut enough to mimic your original ACL. A small grappling hook will anchor the upper end of the graft, and a screw will stabilize the lower end. The screw is usually bioabsorbable, meaning your body will incorporate it into the bone over time. The graft from your hamstring tendon will act as a scaffold upon which a new ACL will grow. Over time, the hamstring graft undergoes changes and is strengthened, leaving a strong, viable ACL.
So how do most ACL injuries occur? Well, getting tackled in football is just one way to hurt your ACL. You could also overextend your knee joint while playing other sports, like basketball or soccer or while skiing. Or you could injure your ACL if you quickly change direction while running or land the wrong way from a jump. Some ACL tears are just partial, while others are complete. The injury that has damaged your ACL can also tear other ligaments or cartilage in your knee. So what should you do if you think that you might have a torn ACL? Well, if you've injured your knee and it swells up, hurts, or makes a popping sound or gives way while you walk, you could have an ACL injury. So stop whatever that you're doing. Even if you're just about to score that game-winning touchdown, try not to move your knee. see your doctor as soon as you can, because you may need an MRI or X-ray so your doctor can see exactly what type of injury that you have. You can treat an ACL injury with ice, rest, and pain relievers such as ibuprofen or acetaminophen, but you may also need physical therapy to get your knee moving normally again. If the tear is so bad that you can barely walk on your leg, your doctor may recommend surgery to rebuild your torn ACL. Whenever you run, jump, or play sports, take it easy on your knees. Talk to your doctor or a physical therapist about ways to prevent knee injuries during play. And if you ever hurt your knee so badly that your foot turns blue and feels cool to the touch, get medical help immediately, because that's a sign that you've dislocated your knee joint and you may have injured the blood vessels to your foot.
Selamat pagi, perkenalkan saya Dani, Fisioterapi di sini. Namanya siapa?
Nama saya Aldi.
Oh, Aldi ya. Pekerjaannya apa?
Kuliah mahasiswa.
Kuliah. Hobinya apa?
Main bola.
Main bola. Lapangan besar.
Lapangan besar.
Tapi di agama apa?
Islam.
Islam. Alamatnya di mana?
Di MIPA 1 Pak.
Oh, MIPA.
MIPA.
MIPA. Usianya sekarang berapa? Apa keluhan utamanya, Pak?
Jadi belakang.
Jadi di belakang dia. Itu sudah sejak kapan ya?
Sudah 1 minggu yang lalu.
1 minggu yang lalu. Ini cedera atau bagaimana?
Cedera.
Cederanya sudah berapa lama?
Sebulan.
1 bulan yang lalu dia. Kenapa bisa cedera?
Gara-gara main bola.
Main bola. Bagaimana? Apakah dihantam atau bagaimana?
Iya, dihantam dari belakang.
Dari belakang. Itu pas dihantam dari belakang, didiamkan atau langsung ke dokter?
Didiamkan, sempat didiamkan.
Berapa lama sudah didiamkan?
2 bulan.
2 bulan didiamkan. Terus habis didiamkan dibawa kemana?
Langsung ke rumah sakit.
Langsung ke rumah sakit. Di rumah sakit dia apa?
Diperiksa. Sempat kesini dulu baru ke rumah sakit.
Oh, kesini dulu. Terus habis kesini disarankan ke
Iya,
rumah sakit.
iya.
Di rumah sakit apa? Dioperasi?
Iya, langsung minta operasi.
Minta operasi. Sudah berapa lama operasinya?
Sudah sebulan 6 hari.
Sebulan 6 hari. Sampai sekarang masih konsumsi obat?
Enggak.
Enggak ada obat sama sekali. Kalau sekarang kondisinya bagaimana? Apakah masih ada nyeri atau?
Enggak.
Jadi ada foto kita bawa? Enggak. Setelah cedera langsung ke dokter. Gerakan apa yang sudah dilakukan? Yang kalau misalkan timbul nyeri?
Biasa bola yang di dinding, tekan yang bola taruh di bawah itu baru tekan di dinding.
Itu tidak selalu muncul nyerinya. Kalau jalan seperti biasa,
Enggak.
angkat-angkat yang berat,
Enggak.
tunduk.
Enggak.
Dari jadi kalau sekarang bagaimana perasaannya setelah sakit ini?
Sudah baik kan, enggak ada nyeri-nyeri apa.
Dari menyeri nggak terganggu di kayak cemas atau
Enggak.
Enggak, jadi ada riwayat penyakit lain Pak, kayak diabetes,
Enggak.
kolesterol, darah, dan jadi ada keluhan lain Pak?
Enggak.
Ya, makasih.
Sama-sama.
Kalau diam begini, ada nyeri kita rasa. Tidak ada nyeri sama sekali. Kalau bergerak, kalau dia sementara tertekuk jalan, kalau dilipat seperti itu kira-kira dari sini tidak ada sakit sama sekali. Kalau di sini tuh dia sakit sekali, sampai pingsan. Di sini sedang-sedang. Kira-kira di mana sakitnya kalau tertekuk?
Tengah-tengah.
Tengah-tengah. Tengah-tengah deh. Kalau saya tekan seperti ini, sini, tidak ada sakit. Sini, sini, tidak ada sakit sama sekali. Kalau ditekan dia. Coba tepuk kakinya. Coba tepuk kakinya. Bisa pelan-pelan. Sakit. Lemas. Yang 5.
Kan 2, 3, 4, 5, 6, 7. Oke, relax. Lagi up 2, 3, 4, 5, 6, 7. Oke, 2. Lagi up 2, 3, 4, 5, 6, 7. Up, pelan-pelan, kasih rapat. 2, bagus. Tarik keras, up, bagus.
Ya. Pelan-pelan. Tangan. Nyata nafasnya. Oke.
3, lagi, up.
Cek perut, terus kepala ke belakang.
4. Sekali lagi.
Oke, balik lagi ya, sebelah lagi. Bentar.
Up.
Naik lagi.
Tahanan. Badan lurus.
2, 3, 4, 5, 6, 7, 9, 10. Oke? Naik lagi. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Bikin 10 kali. 2, 3, turun, 1. Nah, lagi up. 2, 3, turun, 2. Lagi up. 2, 3, turun. Lagi up. 2, 3, turun. 4. Lagi up. 3, turun. Bagus. 2, 3, 4, 5, 6, 7. Turun. 1. Lagi up. 2, 3, 4, 5, 6, 7. Oke, turun. 2. Lagi up. 2, 3, 4, 5, 6, 7. Oke, turun. 3. Lagi up. 2, 3, 4, 5, 6, 7. Oke, turun 4. Satu kali lagi. Up. 2, 3, 4, 5, 6, 7. Oke.
Coba angkat kakinya. Ya, yang betul. Stop. Turun perlahan. Angkat lagi. 6, terus ya. 3. Berhenti. Ayo saja terus sampai 10 menit ya, Pak.
Jam dari sini jam hari ini.
Turun. Turun lagi. Tahan. 1, 2, 3. Naik lagi. Oke. Turun lagi. Tahan. 1, 2, 3. Naik. Turun lagi. 1, 2, 3. Oke, ganti tangan. 3. Naik lagi. Turun lagi. 1, 2, 3. 2.
Ya. Samping dan dicermin. Masih kaki tidak? Ya. Kenapa agak ragu? Takut? Takut? Coba. Ada keluhan? Buru-buru? Ada buru-buru? Iya, ada tadi. Oh, ada tadi. Iya. Memang kan ada saintis. Turun, terus lagi, terus lagi, terus. Ya, angkat, 1, terus 2, terus 3, turun, turun, langsung turun, aman, oke, langsung turun lah, oke ulang, siap. 1, oke, tapi ya begitu saja lakukan. Jadi 2, oke, 3, 4, 1.